Well, hello. I'm Wendy Burton. I'm a GP from Brisbane, and I'm here with my colleague, Dr. Pam Douglas, who's also a GP at Brisbane, and we're going to talk today about tongue tie. So Pam, oh my goodness, it's early 2019. Tongue tie has been a thing, is a thing, it's a real thing. It's been known about for multiple generations. For me, the classic would be perhaps reviewing a new mother with her baby at perhaps that 5 to 10 day mark, and she's concerned the breasts are hurting, there's some pain with the initiation of the breastfeeding, she's worried that her baby's not getting enough milk, the baby's crying, she's not sure about the weight gain, and somebody has already placed in her mind that perhaps this child has a tongue tie or has out and out said to her that they have a tongue tie. When I think tongue tie, I think about that membrane of tissue underneath the tongue that attaches the tongue to the floor of the mouth. And I think if that is too thick or too long, then the tongue can't actually move out past the lips, and that it'll tether, it'll start to take a little heart shape, and that might give problems for sweeping debris off teeth once they've established, not now newborns, or might give articulation problems with speech, so the sounds where we need to move the tongue out, and licking ice creams and important things.
You can't go through life without being able to lick an ice cream.
I know. So I am naturally concerned if there is indeed tethering of the tongue that limits its movement in a way that would compromise that child, either with breastfeeding, with dental care, with speech, or with the pleasures of life such as licking ice cream. Tongue tie, is it underdiagnosed? Is it overdiagnosed? Are we not recognising it? Are we calling normal abnormal? Pam, help.
Of course, there is a classic tongue tie. So presumably from the beginning of time, some of our babies, small percent, we don't really know the percentage, but maybe 2% to 3% of human infants have been born with a membrane under the tongue that impacted on tongue mobility. And again, it would seem to be across cultures and perhaps from the beginning of time that membrane was cut if the impact on tongue mobility affected breastfeeding. But we have seen a serious problem with overdiagnosis and overtreatment of our babies' oral connective tissues, really from 2005. So I guess what has happened is that through the 50s, 60s, 70s, when there was a terrible social breakdown really in breastfeeding, our own profession began to say quite forcefully that tongue tie didn't exist. And it's absolutely true that until the last decade or so, many of our breastfeeding infants were unable to continue on in a breastfeeding relationship with their mother because tongue tie wasn't being picked up. A classic tongue tie wasn't being picked up and cut with a frenotomy.
Pam, what do you say to parents?
And this is when they come in concerned about the tongue tie.
Yeah, so you have an opportunity before the deed is done to talk to them about the diagnosis of tongue tie and whether or not to proceed with a posterior tie release or a lip tie release. What do you say?
So I'll listen first of all and take that thorough history and including a thorough breastfeeding history. I'll then move into an examination. The way I sequence this will vary according to the case, but I may then move into a breastfeeding assessment, just have a look. If the woman hasn't already been feeding the baby, I have opportunity to
Mhm.
have a look at just how she is going about the breastfeeding, how
Mhm.
she and the bubby are going about the breastfeeding. So I've done my assessment, and then we'll pause. We'll discuss what I think is going on, and so most typically it involves reassuring parents that what I'm seeing in terms of oral connective tissue is absolutely normal anatomic variation, but I will acknowledge how confusing this is for parents and how much conflicting input they're getting. I may, depending on the consultation, call on what I know of the research.
What is it that you would say to that desperate mother who doesn't actually give a rip about the history, doesn't want to know about he said, she said, or what the research or the guidelines say, just wants to know what they're going to do with their baby, with themselves, now, tonight, tomorrow, the appointment's booked to have the lasering done. What's your opinion? What do you say to her?
Well, it's so upsetting when we strike breastfeeding difficulties like this. It just really goes to the heart of what we've been wanting to offer as mothers.
It's quite primal, isn't it?
No, it's and the truth is, understanding how to help with these breastfeeding problems, so the nipple pain, the difficulty coming on, fussing, pulling off at the breast, marathon feeds, excessive feeds. This is still a frontier. We're still pioneering around this, and that's why there's been this real trend to over-medicalising, to thinking, okay, let's just cut these oral connective tissues. But unless there's a classic tongue tie, it's absolutely clear that these frenotomies, particularly the laser frenotomies, are not going to help. So what we have to do is look together at what's causing these problems, and it's around the way the baby fits into a woman's body. So when I'm seeing families who've come to me for second opinions, or indeed come to me after they've had the laser frenotomy, I'm seeing breast tissue drag when the baby's breastfeeding. I'm seeing positional instability. I'm seeing problems that we can actually deal with if we look at the new biomechanical model of infant suck arising out of ultrasound studies, in which we're calling the Gestalt model. So I would be asking you to give the Gestalt breastfeeding a go. You can look at the online self-help program. You might go and talk to a lactation consultant who's familiar with this work. You might teleconference in to the Possums Centre at Greenslopes. But I'd invite you to give Gestalt breastfeeding a go before you actually go down the track of laser frenotomy or deep tissue frenotomy.
In summary, tongue tie has both been historically underdiagnosed and is currently being overdiagnosed. The research is indicating that lip ties, buccal ties, and posterior tongue ties are just variations of normal, and that we are doing more harm than good when we intervene and we cut or we laser these areas. The research is also indicating that we have misunderstood how breastfeeding actually works, and that a lot of the reasons why babies are recommended to have this tissue cut has to do not with anything to do with the tissue of their tongue, but it has to do with how they fit and hold, how stable they are at the breast, how well that breast tissue is sitting inside that little mouth, and that there are programs and techniques and ways that you can breastfeed better that will save you A, a ton of money, but B, from actually hurting your baby with the cutting or the lasering. The one exception is the very classic tongue tie. There is definitely still a role for that in breastfeeding difficulties, but if your child has a little heart-shaped tongue and it is doing just great with its feeding and weight gain, oh please be chilled, that is fine, and that tongue will be able to lick an ice cream. Yeah? All right, Pam, thank you very much.
My pleasure.